They started doing these stem cell injections. And I mean, honestly, after the first two, I was hooked. The second one I did was a Vietnam veteran in his early 70s who used to be a competitive golfer. And when I first saw him, hadn't golfed in about 20 years. Chronic knee pain, hip pain, the whole thing. He was one of the first ones. I cherry picked my initial people. I wanted the grizzled man's man type people because I was doing this right in a clinic room with only numbing shots for.
Oh my God.
So so these were quote unquote tough guys, right? But
Yeah.
I brought him back 2 weeks after the injection, and not exaggerating at all, he had tears in his eyes, and he said, "I have been golfing 5 days in a row." And this was
In that short a period of time.
Oh, well, actually, the pain relief started the day after the shots. He started golfing within a week.
Wow. Welcome back to Ultralife Today. My name is Adam Payne, CEO, inventor, and founder of Ultra Botanica, the makers of Protosorb Curcumin UltraCur, the curcumin you can feel. We're continuing our dialogue with Dr. Rowles here in Oklahoma City at our studios. Last week, we had some of your history, Doc, and got into your Navy career, and then kind of a seminal finding when you MRI'd your own arm and found a partially exploded tendon. And that opened the door, especially when COVID started, for you to listen to your wife and try something novel and different. So do you mind just sharing again a little bit about what that was, that what you did at the time, how that affected your world as a practicing physician?
Sure. So at my wife's forceful recommendation, I was taking collagen twice a day and turmeric once a day. And that's literally all I was doing.
So this was just a collagen powder? Was it bovine collagen powder, just or hydrolyzed?
Yeah, bovine. Honestly, I don't remember which brand we were using back then. We've changed so many times since then, but it was bovine, multi-type. There was a lot. I mean, there's 28 types of collagen. So
Sure. And then just off the shelf turmeric as a spice?
pretty much, yeah.
Wow.
Just a scoop in my coffee twice a day, and forget about it.
Smart.
6 weeks
Smart.
later, I was pain-free, and that shocked me. Like, led me into seeking other training, naturopathic training, to figure out what else I haven't learned.
But you came up with your 6-week challenge to your standard orthopedic patients. I think you mentioned at some point that 31 patients over the course of a 2-year period accepted the challenge of trying to do exactly what you did. How many of those people were able to avoid surgery as a result of the challenge?
29. And I would also add to that the two that didn't admitted to me that they did not keep up with taking the supplements.
So did you just kick them back out and say, go ahead and take the supplements? Don't talk to me until you do that? Or you said, okay, well, I guess we'll do the surgery.
Well, I left it up to them, but they wanted surgery at that point.
They did.
Yeah.
Okay. I think there's something kind of ingrained in our thinking that once you've torn something or a tendon or a ligament, or you've ruptured a disc, that your body just doesn't heal those things.
Right.
And that's not true, is it?
No, apparently not. We can heal almost anything. I'm pretty convinced at this point.
Right. And you actually ended up going into areas of functional medicine that include stem cell therapy, include all of the different natural medicines that you were taught in naturopathy. But help us understand for people that are maybe considering doing something like this, what's the science behind this turmeric and collagen powder combination working? Why is that something that works while other approaches haven't worked that well?
Well, the way I describe it to my patients, beginning with collagen, most people don't realize how important collagen really is. It's the way I describe it, literally the framework that our entire body is made on. There's 28 or more different types of collagen in our body.
Sure.
We only make about 5% ourselves, which means
Well, so what do you mean by that? So we when we digest peptides and amino acids, our bodies only produce 5% of what's needed, or do we have to bring in as outside sources collagen that we then can use in our bodies to make more stuff?
well, correct. We rely on our diet for 95% of our collagen intake.
Interesting. So if people aren't eating, I guess what, chicken knuckles and gristle, they're not probably not getting enough collagen into their bodies.
That's the point, and when you're starting to talk about cartilage, well, cartilage is mostly type 2 collagen, and
Sure.
the most common collagen supplement you'll see is heavy on the 1 and 3, and type
Right.
1 and 3, which is good for bone. Those are
But then we got 25 more that people hardly know anything about, including myself. So what can people do? What is the collagen that people should be eating or supplementing with?
well, obviously you want to try and supplement with the most widespread collagen you can. I mean, at the best would be to
Sure.
get all 28 typed, right? But basically, you want to avoid the supplements that specify this is type 1 and 3 because that's all that is. Now, types 1 and 3 are widely available, especially in lean meat. Eat a steak, even chicken, fish. I mean, you'll get 1 and 3, but you don't get a lot of 2. 2 is a much lower amount in our food. An excellent source of
So
collagen.
where does 2 come from primarily?
Well, the same
I'm
source.
not really familiar.
Honestly, it comes from cartilage, right? So
Sure. Okay.
one of the best ways to obtain 2 dietarily is literally bone broth, but make sure that that bone broth includes the cartilage,
Hmm.
not just the meat.
Or the marrow, right?
Well, marrow is good too. You want that as well if you get it. But bone broth is probably one of the best things I've come across, from a diet standpoint. But the reality is our food in this country is so processed and so manipulated that within orthopedics, we've recognized, we call it starvation, really. I mean, the lack of vitamin D, the deficit collagen. But that's when I got out of the military, started treating civilians. That's when I realized, man, stuff's not healing like it should.
Yeah.
Things were taking longer to heal when they did heal. So that's when that's one of the things that opened me up a little bit to like, man, we got to do a bit better with this. We have to start thinking more holistically, as opposed to just following our own algorithm.
Oh, then you throw insulin resistance, which is a chronic problem for many, many, many people here, especially in America with our heavy sugary diets,
Yeah.
which lack really any balance in complex foods or a variety of vegetables and fruits that
Right.
can support our ongoing wellness. We did some work in the past about, just basic amino acid saturation that's in the body. Babies, fetuses and babies, the levels of circulating amino acids are 10 to 20 times higher
Mhm.
than what we have as adults. So you think about it. So it makes sense because babies are growing all the time. They need all of those Legos. I call amino acid, our body's Legos, right?
Mhm.
To be able to build all this stuff. So I guess it's not surprising that collagen would be a part of a repair intervention. But
Mhm.
why the turmeric? I mean, why does turmeric enable your body to heal when collagen itself should be just the answer to what's ailing people?
Well, when I was starting this quote unquote challenge, the turmeric was actually my replacement for the anti-inflammatory medications. So
Yeah.
in my mind back then, it was, well, the turmeric is going to help you with the pain. Collagen is what you need to heal. Since then, I've learned more about specifically curcumin. It's got many functions to it. So it certainly does strongly aid in the healing process as well as provide anti-inflammatory.
Yeah, we know a little bit about curcumin here at Ultra Botanica. It's interesting. There's a lot of evidence to support this idea, and you know this better than probably most physicians out there. In the acute phase of inflammation, when you get that insult, it's that lump is not water that forms in the body. It's literally millions of immune cells that have migrated into the tissues, right? And they're looking for a fight. They're looking for what the bacteria, the injury that they're there to wipe out the invaders or do something or do whatever they've been called into action to do. Which is why ice is beneficial at the early stage of an inflammatory event because it slows the migration, correct?
Right.
But what we've learned is that, and I think, tell me if this resonates with you or not, Doc, is that when the body has this acute inflammation response, that response is not capable of repair yet. It needs to shift. The immune system needs to shift from attack to calling in the civil engineers that can rebuild and repair the tissue. Does that resonate with you? Is that what you found?
Yeah. The way I would think of it, the acute inflammation is actually critical. You need that because that recruits all the troops that are going to needed to fight this battle to get you healed.
Sure.
The problem is when that doesn't really go away and it starts to trend towards being chronic inflammation.
Yep.
That becomes counterproductive, So
Yeah, but most of those cells are trained to eat things and damage things and dissolve bad tissues and kill microbiome or the microbiologics that are coming in invading the space.
right, and plus just cause pain chronically too. So the turmeric, the curcumin specifically, like I said, back to the challenge, that was the pain reliever. Collagen was the healing thing. What the naturopathic training kind of led to was, the simple life changes, and that's when I serendipitously noticed other things getting better.
Interesting.
The other problem we have is, I'm not sure if you heard this one or not, but we crossed, I think 2022 is when we crossed a red line in the United States where now over 50% of the population qualifies as obese.
Ooh.
When you're dealing with degenerative conditions and weight-bearing joints, another thing most people don't realize is when you go up and down a flight of steps, you're putting between 3 to 5 times your body weight and force across the cartilage in your knees
Wow.
and your ankles and your spine. So I had to incorporate, I wanted to, and I had to incorporate weight loss into all of my treatments because that's one way to drastically improve your odds, your results as far as treatment goes. So, again, trying to keep it simple for everybody, just some small list of pretty easy changes that people can make combined with the supplements have done wonders. I'm a big champion of intermittent fasting. That's a wonderful thing metabolically. It leads to weight loss, but it also fixes a lot of other problems, as well as obviously trying to avoid processed foods, trying to stay well hydrated. For God's sake, don't drink your calories, drink beautiful water, little things like that. And that's when you start noticing things like type 2 diabetes suddenly getting better. Obviously, the weight loss leads to pain relief, and then you're taking the collagen. So you're going to hopefully heal whatever chronic injuries you're dealing with. It's been wonderful. And then when you start throwing stem cells into it, now we're talking about supercharging the healing.
Right. So essentially, that is bringing the repair engineers right into the tissues, right? So that's what the stem cells are, is essentially the cells that orchestrate and organize the structured rebuilding of tissues in the body. Years ago, I was involved in a venture that was where they were looking at printing organ tissues by printing a collagen matrix that the body would then populate with the right cells. What they had found, this was over 10 years ago, is that if they transplant an organ into a human body, that over time, the new host, the recipient of the tissue, would replace all of the transplanted cells with its own cells.
Well, let me add to that. For years, all my entire career, we had been doing donor grafts, from time to time. When someone injures their anterior cruciate ligament, their ACL, if it's the second time or more that they've torn it, you can't just keep using their own tissues. You run out of tissues to use.
Sure.
And there's other situations where the person's low demand and has medical problems. You don't want to put them through a bigger surgery with a longer recovery. So there's tangible benefits to using donor tendons, right?
Sure.
Well, simple research early on, I learned that it's only a donor tendon for about 28 days, because by the end of that 8 days, by the end of the first month, the person's own genetics have infiltrated that tendon, and now it's all them. Yeah,
Wow.
incredible what the body can do. It really is.
You know what they were doing at this group in have to go back and look at the research. They were decellularizing the tissues and just leaving behind the extracellular matrix, that collagen scaffold.
Yeah.
And what they learned is that there's information in the scaffold
Hmm.
as to what kind of cells are supposed to be there.
Well, every cell in our body has the code.
Right. But the ECM, that matrix actually has information. So when a stem cell comes into that tissue, it says, oh, this
Mhm.
is supposed to be a smooth muscle cell supposed to be in this space.
Yeah.
And so smooth muscle cells would infiltrate, or the stem cells would start to deposit into that space.
Hmm.
It's really fascinating. 28 days completely changed?
That's what the research told me.
Wow.
You mentioned it's funny. The analogy I use for stem cell injections is we're delivering a whole bunch of SEAL Team Sixes to the area.
And you're doing autologous, in other words, the own person's stem cells back into their body?
That's what we're doing now.
So help us understand, Doc, just what does that process look like of stem cell therapy?
Well, the biggest collection of obviously all of our blood, including the stem cells, are formed within our bone. So the biggest collection of bone marrow that we have is throughout our pelvis. And you can access it through any part of the pelvis bone at all. So it's not really an incision, it's more just a needle stick, but we have a special needle with a spade tip on it that we can pop through the skin, gently tap it into the bone. The good news is the stem cells form. I mean, because you want them right when they're formed, right? They haven't done anything but just sit there. They're just a couple of millimeters to maybe a half a centimeter below the hard cortical bone. So when you put this needle into the bone, you only got to go about 3 or 4 millimeters, maybe 5 millimeters at most. And then you literally aspirate or suck out some bone marrow. You can spin that
Wow.
in a special centrifuge that's designed to recognize, based on the weight of the fluid, what parts it wants to separate out. And that's about a 13 to 15-minute process. And these machines nowadays conveniently deposit that stuff right into a syringe for you on that machine. So at the end of that spinning process, all you got to do is pop a needle on that thing and just inject it where it's needed.
Wow. And I'm curious, do you do anything to activate those stem cells once they're injected?
So that's I call it leveling up, right? So
Ooh.
I have leveled up. Um, I got introduced to, and this is a great story. I got introduced to stem cell therapy. I got to OU in 2015. I spent 2 years. I finally got to the point where I had a nice mature practice, and then I volunteered to move to the VA for an extended period of time for different reasons. It was kind of to help the orthopedic department there, to be honest with you. But when I got there on day one, I was sick to my stomach because a very busy orthopedic clinic, half of the veterans were there for their every third month cortisone shot. And I was very angry to see this. First of all, cortisone is damaging in multiple doses to cartilage. It will make your problem worse over time. Also, every shot you get will not work as long as or as good as the last time you got it.
Right.
At some point, they wear off anyway. These poor vets most of them had a problem that the old me said, well, you needed surgery a long time ago. And they just got pushed down the road, right? And so that's when I decided, okay, no, this is done. We're not doing this anymore. But I needed to replace it, right? And at
Yeah.
that point, I had read reports of stem cell therapies coming out of Europe, Mexico, Canada. Had no experience in it myself. So I literally had to teach myself how to do it. The VA
Wow.
the VA was the perfect place for this because there's no insurance system. There's no one telling me how to do my practice. So I had a very eager and enthusiastic patient base, right? So I started onesies and twosies. I started doing these stem cell injections. I mean, honestly, after the first two, I was hooked. The second one I did
Wow.
was a Vietnam veteran in his early 70s who used to be a competitive golfer. And when I first saw him, hadn't golfed in about 20 years. Chronic knee pain, hip pain, the whole thing. He was one of the first ones. I cherry picked my initial people. I wanted the grizzled man's man type people because I was doing this right in a clinic room with only numbing shots for.
Oh my gosh.
So so these were quote unquote tough guys, right? But
Yeah.
I brought him back 2 weeks after the injection, and not exaggerating at all, he had tears in his eyes, and he said, "I have been golfing 5 days in a row." And this was
In that short a period of time.
oh, well, actually, the pain relief started the day after the shots. He started golfing within a week. But
Wow. Were you also recommending the collagen and the turmeric with this, or was it just this?
this was 2017. I didn't know anything about that stuff back then.
Okay, so this all that predates everything that we're talking
Yeah.
about here.
Well, I mean, and trust me, I'm still angry about this, but I meticulously collected every bit of data I could. One thing led to another, and I spent 2.5 years at the VA, and
Right.
by the time I
Which VA hospital was this, by the way?
Oklahoma City,
Oklahoma City. Okay.
but I had done about 1,500 stem cell injections by the time I left.
Wow.
In the orthopedic research world, we have all these what are called functional scores and surveys, right? I mean, I must have been a pain in the butt to all these vets. You know, I didn't have anybody helping me, so I mean, I'm literally calling them like, I haven't gotten your 2 week survey yet, you know. So I'm bird dogging all this stuff
Oh
because
my God.
I had to learn. You know,
Right.
I didn't know
And
anything.
you had no assistant that could help support this clinical information? No?
Some of the residents were helping me, but no,
Okay. That's
there's
good.
no infrastructure that's going to help you with that. Not the VA, but you know, long story short, that was all of those injections were just me doing the stem cell injection, nothing else, no supplements, no advice about it.
Wow.
All that stuff kicked in after, you know, shortly after I started my naturopathic training. That's when I quote unquote leveled up. That's when I'm like, wait a minute, we can make the stem cells work better. You know, now when I was at the VA, I was there just long enough that the people that were about 2 years out, the pain started coming back. At the time, I was excited. I'm like, well, shoot. I mean, if I can treat somebody for 2 years, you just come back and get another one every 2 years. No big deal, right? You don't need surgery. That's what I thought walking out of there.
Yeah.
Now I expect it to be permanent, right?
Permanent.
But you have to, you know, you have to pay attention to the big picture. You have to make the changes with your diet, your lifestyle, and you have to.
Okay. So we haven't really touched on the diet and lifestyle things. You're
Yeah.
kind of slipping that in here and then in the final hour of this discussion. So what do you mean by lifestyle changes? Are are they necessary for the healing to take and to be permanent? And are we just talking about, the fast food epidemic, obesity, or is there something else going on that you think needs to change in their lifestyle and in their nutrition?
I'm not going to use the word necessary so much because I did have a few people that were still going strong 5+ years out. So there's, you know, there's a subset of people that just respond fantastically to the stem cells.
Sure.
But, you know, obviously we have to attack the people that aren't responding as well, right? That's
Yeah.
what we pay attention to. These are easy things. I mean, this is nothing more complicated than exercise 3 or 4 times a week, low impact. And the best exercise I can think of is get outside when it's a beautiful day out, get some sun, and go for a nice gentle walk. Work up a sweat, you detox, you get your vitamin D,
Mm.
aerobic exercise. That you know, just don't you know, there are replacements for sugar. There are healthy replacements for sugar.
And so you're talking about insulin resistance and getting our bodies moving so that we actually can move nutrients through our bodies. When we're sedentary, stuff doesn't it's like it doesn't move. Stuff doesn't happen. I
Exactly.
mean, one of my dear friends, Kyle Drew, who also works here at Ultra Botanica, he's a clinical nutritionist. He talks about hydration a lot being one of the most important factors.
Oh, yeah.
Most people are not taking in enough water on a daily basis.
And I'll tell you, you can tell that that's one of my most important points when I'm consulting with somebody pre-stem cell injection. I make sure they understand that they need to be extremely well hydrated because when I'm pulling out that bone marrow, I know whether they're hydrated or not. It either comes out this nice, quick and easy dark pink fluid, or it comes out purple sludge, one small drop at a time.
Wow.
You can tell which one's dehydrated, you know? So, plus my research at the VA, I realized that the better hydration leads to just you get more stem cells, period. You know, I mean, you're able to extract more stem cells. So you get the most bang for the buck. That's, you know, that's just stem cell specific, but obviously proper hydration is critical for everything, you know.
Sure.
Our body is mostly water to begin with.
And then we get into insulin resistance being kind of the scourge of the American wellness system these days, and the resulting epidemic of diabetes. We've been talking to Dr. Douglas Rowles at Revive Stem Cell and IV Therapy. here in Oklahoma City. You can go to revivestemcell.com. They're located up on West Memorial Circle near the Mercy Hospital up there. Do yourself a favor and get with Dr. Rowles sometime in the near future and get your stem cell therapy going, or talk to him about the possibilities of it. Doc, any closing ideas here before we close out this week's discussion?
The bane of my existence has been for a long time now when patients are told, they get an x-ray of their knee. Oftentimes it's by their primary care doctor, but including a lot of orthopedic doctors will say the same thing. Oh, you need a knee replacement. Well, maybe you don't. That's the whole point of this, right? I've, just my last few years at OU, probably at least 5 or 6 people at least had such a great reaction to the stem cell therapy that they didn't, they had no thoughts of needing a knee replacement.
That's amazing.
So the body can heal, and if you give it appropriate treatment, it'll heal much better. So we don't know what we don't know, and get used to different.
It's amazing what can happen when we actually give our bodies the tools it needs to recover. That's right. Positive thinking, good spiritual grounding, and a nice healthy dose of stem cells to aid in the healing process. Well, you've been listening to Ultralife Today. I'm Adam Payne, your host. We'll be back next week continuing our discussion with Dr. Douglas Rowles here on Ultralife Today.